If you or someone that you love has ever tried to find behavioral health support in Alabama, but maybe you felt like you didn't know where to start, or you were Googling and not really getting anywhere, great news. We are doing a whole series of videos on an app that you should know about called Connect Alabama. And we've been talking to several people who are connected to this app in one way or another. And today we're joined by Shanna McIntosh, who is the director of Vital Alabama, which is wonderful. I'm so glad that you're here. Thanks for being here with us. We want to just start this video by saying, tell us a little bit about you, kind of what your background is and how you got to be in the role that you're in.
Sure. So I have been in behavioral health now for almost 2 decades.
Okay.
Seems like forever.
Yeah.
So I started out working in the realm of substance use. Psychology and counseling that's my background.
Okay.
And then from there, I had an opportunity to work with community mental health, working with the severely mentally ill and being able to actually get out in the community and not just in the office. And then took a part of a director role over a substance use division where I had an opportunity for a couple of counties running inpatient and outpatient units. And then the University of Alabama recruited me to come work a program for them. Wow. And they said, hey, we have this program and we need to develop it. And we would really, love for you to interview for it. Yeah. So I was like, wow, okay, that's different. And they were like, oh, yeah, and it's a grant-funded program. And I'm like, okay, great, thanks. And so I came and helped them build the ESPERT program for the state of Alabama. So did the program development for what is now the Alabama ESPERT program. And while doing that, I was working with the principal investigator for the ESPERT program. And his name's Dr. David Albright. Okay. And so he and I both had this big vision. And we said, okay, we can do so much more. I had been working in direct care and working on that side of everything in behavioral health for so long. And then now seeing this back end side of it, this grant world, this program development side, this opportunity to really be able to help improve systems. Yeah. And I said, I love this. And I said, we can do so much more. And he said, I want to do so much more. We can totally do so much more. And so he and I actually co-founded Vital at that point.
Wow. Okay.
And so that was in 2017. The idea kind of came around in 2016, and then we really put it into fruition and we went live with it in 2017. And we took our one grant program that was building the ESPERT program for the state of Alabama, and we have just continued to grow and develop and try to find gaps. I think that's my biggest thing is we have a lot of amazing staff. We have a lot of amazing agencies and workers and a lot of really promising programs for individuals to be able to seek services from. But we, just like any other place, have gaps too.
Absolutely.
And so one of our biggest purposes is to be able to look and find those gaps and see how we can fill those gaps. So that's where Connect Alabama came from. Yeah. We built a prototype for this app back many years ago and we knew that there was a need for access. There was a need for a better way to find services.
Right.
And so so that's kind of how the Connect Alabama app came around, was being able to fit that niche, fit that whole of it all. Yeah. And I love being on this side of things now because I've been on the direct care side. Okay. So I feel like I understand the struggle of what an individual that is trying to help serve someone and help ensure that they have resources and making sure that they're up to date on all of the latest trends and the evidence-based practice, opportunities that they could learn. So I can then take that and help on the other side of it, build something for them.
That's really cool.
Yes.
What a great story.
Yeah, thanks.
Okay, well, let's kind of talk a little bit about the app itself. But actually, before we go there, let's start with, what do people typically do if they feel like they need help or someone that they know needs help? What is their first step usually?
Google. Yeah. What is your first step for anything?
Oh, everything.
Right?
Google.
Yeah. We're just going to Google it.
Yeah.
We're going to see what pops up. And guess what pops up first these days?
Well, first of all, AI summaries and then paid ads.
Exactly. Right. And so that's what they're going to do first. They're going to go to Google. They're going to really hope that Google is going to tell them everything that they need. But what we know on the other side of it is that Google is going to tell them what someone else wants them to hear first.
Exactly.
And then, but like you said, even now AI, like it's going to tell you what Google thinks is the best opportunity and the best, mechanism of pulling all of the information that's out there on the great World Wide Web. So that's what people are going to do first. They're going to go to Google. And unfortunately, I love Google. I don't know what I would do without Google, but it's not the reputable source. It's not the on the ground, like in the field, in the trenches source to be able to get information for yourself or a loved one.
Yeah, absolutely. So instead of Googling, if someone uses the Connect Alabama app, what are some of the benefits of doing it that way?
So first and foremost is it is 100% Alabama based.
Okay.
So you may Google and it may pop up a treatment facility. And then once you click on it, it's actually in Texas, right? Because this particular group has enough money in marketing to be able to try to have Alabama residents come receive phenomenal treatment, I'm sure of, right?
Yeah.
But that might not have been what I was looking for.
Right.
So you're going to get 100% Alabama-based information that's going to come in the Connect Alabama app, whether it is out of our education information kind of section where you're just trying to learn. It is going to give you Alabama-specific education and information. This is how you get into treatment in Alabama.
Okay.
This is what is required at an Alabama treatment facility. This is what to expect afterwards.
Yeah.
And then if you're searching for treatment itself, we're giving you opportunities for services and resources that you can get here in the state locally.
Yeah, that's great. So I know that there's a whole resource section of the app. How are you vetting those resources? And then what does it mean even to vet them? What does that process look like?
Sure. So when this app, when the prototype was even built, my biggest concern was ensuring that we had reputable resources, ensuring that we had up-to-date information, because there's nothing worse than trying to call someplace and the phone number's changed or the location has changed or the contact person has changed, right?
Yeah.
And that's really hard.
Yeah.
Like it's very difficult. So what we do as far as a process of being able to get on the app is someone can request to connect. That's actually what we call it, is request to connect.
Okay.
Or working with our state agencies, if they have a specific set of services that they would like to have added on the app, those will come to us. We're going to ensure that that group is credentialed, whether it be that they have certifications that are at a state level or a federal level, but there's some sort of oversight that is happening within those services. We're going to ensure that they're actually providing the level of services that they say that they're providing. And we even go as far as to do phone calls to make sure they're going to answer the phone when you call.
I love that.
And so that's a part of that vetting process. And then to even continue to stay on the app, every 90 days, they have to recertify. Is your information correct? Is this still how you access services with your group? Is there anything that's changed? That kind of thing. And they do that every 90 days to be able to help keep it up to date as best as possible.
That's great. I love that you're vetting them continuously and it's not just a one-time thing.
Correct.
That's great. So as we look at the overall behavioral health infrastructure of the state of Alabama, how does Vital fit into that? What is the role that you guys are playing in that?
So we fit in a lot of different ways.
Okay.
We kind of started out on a path that was taking us down this substance use route, and we were really kind of working within that. We ended up having a really cool opportunity to spread into some of the more mental health aspect of what was going on in the state. And then even since then, like we look at workforce development, whether that be from a behavioral health perspective or even from an employer perspective, just in like commerce and labor and things like that. So we've had a chance to really grow in a lot of different ways. But as far as us with the infrastructure, we are not a service provider. There are service providers out there doing great work. We are not a service provider. We are not a state agency. There are state agencies out there leading the charge and doing the things that they need to do as it relates to oversight and systems at state level. We're that piece in the middle. So we kind of serve as a liaison between our state partners and other stakeholders and the state agencies. We serve as a intermediary that will be able to help provide better capacity and infrastructure, whether it be for an agency or whether, that's providing services in the community or whether it be at the state level.
Okay.
And so we kind of serve in that intermediary role to ensure that both sets of groups and all of the stakeholders that we could possibly influence in a positive way and provide support to in a positive way get the best out of us.
Okay. Tell me about the speaker request feature. I'm interested to hear more about this.
Yeah. So we would oftentimes go to events and maybe it was one of our staff that was presenting, or maybe we had even sponsored a speaker that was at an event, and we would have people come up and say, hey, like, will you come speak at this event that we're having, or this or that? And so we realized that it was occurring a little more frequently, but it was sometimes coming to a one-off person that was just happened to be at that event.
Yeah.
So we wanted to formalize it. And so anyone in the state that is looking for a speaker on a behavioral health topic, so substance use, mental health, anything within the realm of that, they can go into the app and they can request a speaker.
Okay.
So we serve as that kind of place where it lands, and we will look at the need. If Vital can fill the need, then we do. We say, okay, hey, this is within our wheelhouse, our capacity. We can do this, and we will move that on. However, if we can't, and then we can't either internally with our own staff or internally with our financial support to be able to support one, we will find the next best group to be able to support that need in that community and make that connection.
Okay.
So this way, whether it be a church that's looking for someone to come speak to a youth group, or it's an association looking for a professional to come speak to another set of professionals, or anywhere in between, we can help fill that gap to make sure that we're getting evidence-based information out there, and that the information is consistently supporting the mission and vision of the state of Alabama.
Yeah. So that's a really cool feature, I think. What are some of the other features on the app? Can you kind of talk me through what all is available through the app, and then what are your favorites?
Yeah. The app has grown so much, especially from the prototype that we built, like even before this current app that's out there launched. So we have these built-in screening opportunities. And let me just say this, first of all, nothing in the app is saved or used outside of what you're using it for in that moment. So we are not holding on to data. Everything is completely anonymous. Anything in the app is safe. We wanted a safe space, right? Yeah. So we have these screening tools that we've built in. So maybe you're questioning some kind of things that you've noticed about your own behaviors, right? And so you can have an opportunity to go into the app and screen for anxiety, depression, alcohol use, tobacco, suicide risk. You know, we have different opportunities that you can do that. It doesn't save. So just know that once you've completed the screening and it gives you some results, those aren't saved. So you have to go back in and you have to do those all over again, right?
Okay, yes.
But it will give you that. And it's not just for you. Maybe you are concerned because you've noticed some signs or symptoms or things with a loved one.
Yeah.
So you kind of want to go in there and look and say, hey, like, this is what I'm seeing. Is what I'm seeing really true?
Yeah.
So I really love the screening tools. And then at the end of it, not only does it give you what would be a result, like, hey, like this is kind of a numerical value and this is what that numerical value means. It also then says, these are the suggestions. You know, clearly you need to see, you know, a physician. You do not need to take anything that we say, you know, outside of the physician's context, but it'll say, hey, we highly suggest that you see someone to get further assessment. And then we're going to give you a list of places to go. Click this link and this is where you can, you know, go to be able to get that. Yeah. So it's not just, hey, I'm going to do this assessment and see where I land. But then it's like an immediate opportunity to be able to get connected to someone that you can follow up with if you choose to in that moment. So I really love that.
Yeah.
We have direct call, direct text out of our hotlines, helplines, crisis lines. So, you know, everybody's like, okay, well, why would we go into your app instead of just do 988? Like, that's so much easier. 988 is easier now. Well, we'll say when we developed the app, 988 wasn't the thing. So like it was easier to go in and click and that kind of thing. But there may be more than 988 that you want. We highly promote 988. It is a great resource. It's going to get you more than just someone that is in a crisis situation for maybe suicide or something like that. It's much more than that. But you can go and look at a lot of different helplines, hotlines, and crisis lines, and it's direct call, direct text. Like, it's just click and go. So I really like the fact that we have a lot of different choices in one place.
Yeah.
You don't have to go do the Google thing where it's, you know, and
it's
then,
all just right there.
Yeah, absolutely. Yeah. It's just one-stop shop. So that's great. And then we have a partnership with the Recovery Resource Center in Birmingham, and they are providing free telehealth substance use assessments. And this is a big deal because to get into a state certified substance use facility in the state, you have to have the state certified assessment to be able to do that, which is based on this ASAM, all this technical jargon, right?
Mm-hmm.
But you have to have that. And sometimes it's really difficult to get to a place that can do that, whether it's to get them in a timely manner, whether it's you just don't have transportation. And then sometimes you don't have the finance
Right.
to be able to afford that. So you can go into the app and you can request a telehealth assessment from anywhere in the state. It goes privately and safely to Recovery Resource Center. They have your information. They reach out and they set up a free telehealth assessment so you don't ever have to go in anywhere.
Wow.
And then they make the referral for you to get into treatment.
Wow. That's amazing.
Yeah.
It's just you're removing all the speed bumps.
Yeah. We're trying. We're really trying. It's really about access and how do we ensure that anywhere, anyhow, anytime has access. And so this isn't really a feature, but more of a back-end kind of built-in piece. When we went to market with this, I said, we will not go to market if you can't use this app anywhere, anytime. And they said, oh, yeah, no, I mean, it's a 24/7 app. What do you mean? And I said, we have a data desert in the state of Alabama. There are so many places where you do not have cell service. There are so many places where even if you have cell service, you might not have appropriate internet or Wi-Fi. I said, when I mean anytime, anywhere, I mean anytime, anywhere, no matter what your capacity is for your phone. And they said, okay, so on the back end, you do not have to have data to access any of this information.
Wow. Okay.
So as long as you've had Wi-Fi to download the app, the directory is 100% accessible.
Okay.
The helplines, hotlines, and crisis lines, 100% accessible, as is the education and information. Now, should you click on one of our Google Map links to get directions and you don't have access to Google Maps in that moment? Yes, no, that won't work, right? But you can still click to call the phone number and get out, or you can at least read the information. You can get prepared. You can have the information at your fingertips no matter what.
That's great. I'm so glad you guys thought of that. It's not something that everybody would think about. So
Right. Yeah. I mean, and how often do you get, you're playing your favorite game and you get into the airplane and put it on airplane mode and you can't play your favorite game.
Yeah.
Right.
Yeah.
So we want you to be able to have access anywhere,
That's great.
anytime.
That's great. If you wanted someone to remember one thing from what we've talked about today, what do you think it would be?
Access isn't impossible.
Mm-hmm.
And there's help out there for everyone, no matter if it's for yourself or someone else. There's some level of education and information out there. You should be able to find the most of it in the app itself. However, if you can't, it's likely going to get you directed to where you can.
Okay. If we talked about something today that you feel like is relevant to you, whether you're looking for help or you're supporting someone who's looking for help, or maybe you work in this space, maybe you're a therapist or you lead a support group, the Connect Alabama app is free and it's available right now. And it is built specifically for people in Alabama. So definitely check it out either on the App Store or Google Play. And you can also find everything at vitalalabama.com. We've been talking with Shanna McIntosh, who is the director of Vital Alabama. Thank you so much for being here with us today. We really appreciate it.
Oh, thank you for having me.